Happy 2025, everyone. Today is Saturday, January 4th, 2025. I actually wrote down 2024 in my paper. Oops. All right. And this is week 41 results of being back on Mounjaro. And I'll also talk about my doctor appointment as well as a conversation I had with my primary doctor this week. I struggle sometimes wondering what to discuss in these because I know for these videos I label them Mounjaro weekly update, but then I also talk about my other medical conditions that's happening, and sometimes I wonder if I shouldn't keep these videos separate. Keep my Mounjaro journey to videos, and then keep my other issues like my generalized myasthenia gravis, the autoimmune disease that I'm dealing with, keep those on separate videos. I wonder, because some people might just like updates on Mounjaro, especially if they're on Mounjaro or thinking about going on Mounjaro, that they're just looking for videos dealing with that, and they don't want to hear about other things. Same way with my autoimmune disease, my generalized myasthenia gravis. Some people might just want to hear about that, but they might not always know about these videos because I label them Mounjaro. And though I try to put GMG in the description as well if the video is going to talk about GMG, which mostly they do. So of course I have the diabetes. So yeah, if you have an opinion, go ahead and comment what your opinion would be on that. If you don't mind hearing my update about all my medical journeys, or you wanted to keep it to specifically to Mounjaro talk, or about GMG or diabetes talk. Well, Mounjaro and diabetes it goes hand in hand. Except what Mounjaro is for diabetes, but also you get the positive side effect of weight loss. So those two kind of go hand in hand. But now, let me know if you feel like they should be separated out into different videos and labeled as such, or it's okay just to keep it all together because it's all about my journey, my health journey. So let me know in the comments what you think about that. So, but anyway, let's go ahead and talk about. I did get a call back from my primary doctor. I had told you on last week's video that I had got a call and I missed a call from my primary doctor. And she said she wanted to talk to me about my prescription that I had, but she didn't tell me which one. And I was speculating that she was calling to talk about Mounjaro and she would probably want to lower down the dose that I'm on. Right now, she moved me to 7.5. That was about month and a half ago, I think roughly. It's about what, beginning of December or late November, and she moved me to 7.5 to help counteract the higher dose of steroid that I was on. So I'm on a 20 milligram of prednisone that I take every day for my GMG, my autoimmune disease. So, and my weight was going up, and every once in a while I would get a high blood sugar count. My A1C had gone up just a little bit, went up 0.6 at that time to went from 4.6 to 5.2, which I know it's still really good. That's really good for someone with type 2 diabetes. So, but it was going up. It's a trend. So, one time I don't know if it's a trend or not, but anyway, that's what she was concerned about. So that's why she doesn't usually like to increase Mounjaro doses on people who have controlled diabetes because she doesn't prescribe it just for weight loss. At least not Mounjaro. She knows that there's another version of it now for weight loss itself, but I do it for diabetes control. So she's always hesitant. She's really good about not going up when it's not needed. So, but anyway, yeah, she did not call me about that because I thought, well, because I started to have low dose episodes and I had talked to my neurologist the week before or whenever it was about it. So I thought maybe the neurologist got with my primary and they decided maybe I should go down on dose because my low blood sugar episodes that I have. I didn't have any of those this week, by the way. So I don't know if that's good or bad. Maybe that means my blood sugar is starting to increase more now that I've been on the steroid for almost 2 months. I've been on a higher dose of steroid at 20 milligrams for almost 2 months now. This week here coming up is my my 8th week, which will be 2 months on it. I have to call my neurologist up this week to let him know how it's going because he wanted me to be on it for 2 full months and talk about my symptoms and see if my symptoms held steady or improved. And he was going to start trying to wean me off of the steroid because of my liver cirrhosis, my non-alcoholic fatty liver disease for liver cirrhosis. That was the other medical condition that I forgot to mention that I deal with. So, but he wants to wean me off of the steroid if at all possible. If he can keep my symptoms to hold steady or improve, he'll try to wean me off the steroid, and hopefully they continue to be better. So, but anyway, so she called me up on Monday at the end of the workday. It was about 4:30 in the afternoon, and she did not want to talk about Mounjaro. Well, that's what she wasn't calling me about. We did talk about it, but that's what wasn't what she was calling me about. She was calling me about my statin. I'm on a low dose atorvastatin. I've been on it forever. It's been almost 20 years that I've been on it for my cholesterol. So my cholesterol is not horrible, but it is high when I'm not on a statin. And we tried that again this summer uh, before, and we tried to take me off it because I asked if I can try not being on it anymore since my cholesterol has been good for years. But she said, no, once you're on it, you usually stay on it. So we tried it, and of course my cholesterol went up. So I had to go back on it again. So staying off it was not a good because it shut my cholesterol up. So, but there's been talks about statin possibly affecting autoimmune disease. It can either trigger it or it can make the symptoms worse. And so she's like, with that new talk about that, she said that let's try going off the statin again, see if that helps with my symptoms of the autoimmune disease. So, and she said, since you're on a low dose anyway. So, okay. It's like, well, last time I tried getting off of it, my cholesterol did go up. So she said, let's go off it for 2 months. And then at the end of the 2 months, let's talk. She's like, if your symptoms improve more with you being off of it, but we'll test your blood. And if your cholesterol goes up, then she'll prescribe me something other than a statin to treat my high cholesterol. So I was like, okay, we can give that a try. So, and then we also talked about Mounjaro. I told her no, I had been having episodes, low blood sugar episodes, and usually it's on Mondays, Tuesdays time frame in the week. I take my shot every Saturday morning, and usually it's on Monday night, Tuesday night, somewhere in there is when I have my low blood sugar episodes. So asked her, should I go back down to five milligrams of Mounjaro, or not milligrams, yeah, milligrams mg. So I go back down, and no, she's like, well, I think you should stay on 7.5. We can talk about it again if you ever get off the steroid, and if your weight increasing has stopped, and hopefully I can start going down. Then we can talk about going down. She's like, is it quieting your hunger thoughts? Because now that's what Mounjaro can do as a side effect. It can quiet that hunger chatter in your head. And I told her, yeah, it has. Going up on dose has helped with the hunger cravings, the sweet cravings. And I still crave sweet sometimes, but the hunger chattering that goes into your head for someone who, if you know what I'm talking about, who likes to eat, the hunger chatter in your head that makes you want to eat. So she's like, yes, that it does improve it. So she's like, okay. She still left it up to me. She's like, I think, she says, I think you should stay at 7.5, but it's your call. I'll let you decide. And I told her, no, let's go ahead and stay. Because I worry about going down to 5.0 and that the hunger chatter going away and uh, how quick I get full when I eat goes away because I don't want anything to speed up weight gain because I got the steroid for that. So we are staying on 7.5 dose for now. So that's where that is. And then also I had my uh, appointment Thursday with the surgeon, with the thoracic surgeon, to talk about taking out my thymus to help treat my autoimmune disease, my generalized myasthenia gravis. Uh, I don't have thymomas, which are tumors. I don't have that, so it's nothing urgent. And she agreed. She said I actually make a good candidate to have the thymus removed. The thymus is kind of what helps you develop your autoimmune system when you're born. You know, it's there and it's big when you're born, and then as you grow up, it helps you to develop your autoimmune disease. Helps you develop your immunities, so your body fights off things. So it's your autoimmune system. It helps to develop. It helps to develop that. There's more time. I won't go too much into it, but that's what that does. As you get older, you no longer need it, and so it shrinks. But for people with myasthenia gravis, that could go haywire and become overactive and enlarge and cause your body to develop more antibodies than what it needs, and that's what attacks. That's what kind of what causes autoimmune disease, the myasthenia gravis. For some people, anyway. Then sometimes they can develop tumors called thymomas, which can also cause the autoimmune disease. So, but I don't have thymomas, as far as we know. The surgeon said what they do is they'll take it out. She actually goes. She doesn't go to the top like some do now. She will go through the right side of the ribs. So what she does is she'll go through the ribs. She'll deflate the lung on the right side. They'll stick her tools to get to the middle where the thymus is at. The thymus sits right below the breastbone, right above the heart. So she'll stick a couple things underneath the rib cage up front here, and then she'll have an assist something go on the left side all as well. And they'll slowly kind of they'll start at the bottom of the thymus is like an X. It's like an X shape, and then so cut away at some bottom and work your way up, and then she'll take it out kind of like in one piece. And the hole on the right side is a little bit bigger to be able to fit the thymus in, and they have to try to get all of it. Because if you don't get all of it, it could still cause issues. And then she'll take it to pathology, because you still could, even though the scan doesn't show any thymomas, no tumors, there still could be small ones in there that the scan didn't pick up. So she will send it all to pathology just to make sure there's no tumors in there that was too small for the scan to see, but could be triggering the myasthenia gravis. Because we still don't know what triggered it. It could be from the vaccine, for the COVID vaccine that I got, uh, or that could just made it worse. Or who knows? Sometimes you just don't know what triggers an autoimmune disease. So, but anyway, she said I'm a good candidate for it. She wants to wait 6 months or close to 6 months first. She wants to make sure that my symptoms are stable and hopefully get off the steroid. So hopefully I can get off the steroid and stay off of it, and my symptoms are gone. I'm not having any symptoms for the autoimmune disease. So, well, she said let's talk again in June. Because I was talking about my 5 cruises this year, and I have a good window. My Australian cruise is May, and then my birthday cruise is in August. So we have a good window there. She said it's a 4 to 6 week recovery for it. So she said let's shoot for June. So my surgery isn't scheduled yet, but we are shooting for June. So we'll monitor my symptoms and see where I land, see if I can get off the steroid, and if all goes well, she said we will talk again at the beginning of June, and if all is going well, we'll schedule the surgery for June. So that's that update. So stay tuned with that. So, all right, let's go ahead and test my blood. Got my diabetes device here. Got my pad, alcohol wipe, pad. You meant what I knew. All right, so let's pick on the pinky this week. get the blood flowing into the tip of the pinky. Right here. There we go. Fasting, because I just woke up. I haven't ate yet. All right, it's at 90. Not shabby. Last week was 85. Week before was 91. Week before that was 89. So I haven't had a bad reading in 4 weeks. Week 37, I had a reading of 103. So went from 103 back down to 89 to 91 to 85. Now it's 90. So that's good. Mounjaro is working. I said I didn't have any low blood sugar episodes this week, thankfully. So that is all good. All right, let's do the Mounjaro shot. For those of you who know, it comes with the cap. Remove the cap, and then you want to unlock it, and you can go in the fatty part of your arm. I call it my bat wings, or your gut, where I like to do it, or the inner part of your thigh. So let's see. I did this side last week, so we'll do this side this week. It has to be at least 2 inches away from your belly button. So I like to prop up my fat. There we go. I want to make sure so you can see the plunger. Watch the plunger go in. All right. Let's see here. There we go. That's good. Voila. It was really simple and quick. No drips, no blood spots. Yay. It's that simple, folks. All right. Last but not least, my weight. Last week I weighed in at 246. And this, or not 246, sorry, 242. Weighed in at 242 week 40, which puts me at +6, a 6-pound weight gain since being back on Mounjaro, but while dealing with this autoimmune disease, which is counteracting the side effects of Mounjaro, unfortunately. Well, this is week 41 results, and I'm at 242. So I did not gain, I did not lose. So I'm happy I didn't gain any. That's the main thing. I love to be able to start losing again, but I didn't go to the gym at all this week. I didn't attempt it. I was just too tired. This autoimmune disease is for real, folks. It just zaps your energy. It just makes you tired. On top of that, you have to be careful with not fatiguing your muscles, because if you overexert yourself, that makes you even more tired. If I even tried to exercise, then I'm wiped out. I have to take a nap. I'm just so tired. I have a hard time keeping my eyes open. I was like, so tired. That's on top of, if you overdo your muscles just a little bit, you get fatigued and you get weak. So yeah, this generalized myasthenia gravis autoimmune disease is for real. It is nothing to play with. So like I said, my symptoms right now are okay. I did have some droopy eyelids this week. It wasn't horrible, but I think it's because I'm so tired. As you can see, looks like I got some black eyes. I am tired. I'm not sleeping well. There's another thing I want to get off of the steroids, prednisone, because I still sleeping awful. So even with my CPAP machine, I'm sleeping awful. So I'm not well rested at all. So okay, I feel my speech going a little bit, so I'm going to end it there, folks. Yeah, it's time to end it. All right, you all have a great weekend and enjoy. Remember to enjoy life. If you like this video, hit the like button. And if you are new to my channel, if you want to continue to see my videos on my medical journey, go ahead and hit subscribe so that you can be notified of future future videos. Okay, I gotta end it. Bye bye. Love you all.